Gliptins, DPP-4 inhibitors. They are the oral antidiabetic drugs that improve glycemic control by increasing endogenous incretin hormone activity, making them an important treatment option in type 2 diabetes mellitus. The gliptin family. 6 key agents in this class include Sitagliptin, Vildagliptin, Saxagliptin, Linagliptin, Alogliptin, and Teneligliptin. Mechanism of action. DPP-4 inhibitors block the enzyme dipeptidyl peptidase 4, which normally degrades incretin hormones such as GLP-1 and GIP. What happens when DPP-4 is blocked? The first step is that incretin levels rise. Normally, the DPP-4 enzyme rapidly breaks down incretin hormones such as GLP-1 and GIP. When DPP-4 is inhibited, these hormones remain active for longer. As incretin levels increase, insulin secretion increases. Importantly, this occurs in a glucose-dependent manner, meaning insulin release is enhanced primarily when blood glucose levels are elevated. At the same time, glucagon secretion decreases. Lower glucagon levels reduce the liver's production of glucose. As a result, hepatic glucose output decreases, helping lower blood glucose levels. These effects occur in a glucose-dependent manner and primarily improve postprandial blood glucose control, while maintaining a low risk of hypoglycemia. Adverse effects. The first commonly reported adverse effect is headache. Patients may occasionally experience mild headaches, but these are usually transient, resolving without specific treatment. Another common adverse effect is nasopharyngitis. This refers to upper respiratory tract symptoms such as a sore throat, nasal congestion, or a runny nose. In fact, upper respiratory symptoms are among the most frequently reported side effects with this class of drugs. Some patients may also experience GI symptoms, including mild gastrointestinal discomfort, nausea, or diarrhea. However, these symptoms are typically mild and less prominent than those seen with GLP-1 receptor agonists. Overall, these drugs are generally well tolerated and have a favorable safety profile. Rare but important adverse effects. The first is pancreatitis. This is a rare but serious adverse effect. Patients should be advised to report severe or persistent abdominal pain, especially if it radiates to the back, as this may indicate pancreatic inflammation. The second category is hypersensitivity reactions. These may include angioedema as well as severe skin reactions. Although uncommon, such reactions require immediate discontinuation of the drug and appropriate medical management. Another important adverse effect is arthralgia or joint pain. In some patients, significant joint pain has been reported with prolonged use of DPP-4 inhibitors. Symptoms usually improve after stopping the medication. Cardiac safety note. Overall, DPP-4 inhibitors are considered cardiovascularly safe, meaning they do not increase major adverse cardiovascular events. But they do not provide the cardiovascular benefits seen with GLP-1 receptor agonists or SGLT2 inhibitors. Clinical studies have shown that Saxagliptin may increase the risk of heart failure hospitalization in susceptible patients. For this reason, it should be used with caution in individuals who already have heart failure or significant cardiac conditions. Clinical uses. Their primary indication is type 2 diabetes mellitus. These drugs can be used as monotherapy in patients who cannot tolerate metformin. More commonly, they are used in combination with other antidiabetic agents such as metformin, SGLT2 inhibitors, sulfonylureas, or insulin to achieve better glycemic control. An important advantage of DPP-4 inhibitors is their favorable safety profile. They are particularly useful in patients at risk of hypoglycemia because they enhance insulin secretion in a glucose-dependent manner, resulting in a low hypoglycemic risk. DPP-4 inhibitors are generally well tolerated, easy to administer as oral tablets, and are largely weight neutral, making them a practical option for older adults. Key advantages at a glance. The first advantage is low hypoglycemia risk. Because these drugs work through a glucose-dependent action, they enhance insulin secretion only when blood glucose levels are elevated. As a result, hypoglycemic episodes are uncommon when DPP-4 inhibitors are used alone. The second advantage is that they are weight neutral. Unlike some antidiabetic drugs, they do not cause significant weight gain, making them a useful option for overweight patients who wish to avoid additional weight-related complications. Another important benefit is that they are elderly friendly. DPP-4 inhibitors are generally well tolerated in older individuals, even those with multiple comorbidities, and have a favorable safety profile. Finally, they offer excellent combination versatility. They are compatible with multiple antidiabetic drug classes, including metformin, SGLT2 inhibitors, sulfonylureas, and insulin. Summary. The first key concept is these drugs inhibit the DPP-4 enzyme, thereby preserving GLP-1 and GIP. As incretin levels increase, they promote glucose-dependent insulin release, improving glycemic control while minimizing the risk of hypoglycemia. The second point is their safe profile. DPP-4 inhibitors have a low hypoglycemia risk, are generally weight neutral, and are considered elderly friendly, making them particularly useful in older patients and those with multiple comorbidities. Finally, remember what to watch for. Although uncommon, clinicians should remain alert for pancreatitis, arthralgia, and the potential cardiac risk with Saxagliptin in susceptible patients.